Medical experts from Lagos University Teaching Hospital and the NSIA LUTH Cancer Centre has raised concern that 70,000 naira minimum wage makes breast cancer treatment unaffordable for many Nigerians. They emphasize the importance of early detection, personalized treatment, and warn against alternative treatment which can worsen outcomes. Professor Wosu Adeyomo and Dr. Lawal Abdurazik stress the need for awareness, highlighting the early detection can make breast cancer preventable and curable. They noted that high treatment costs and limited access to specialized facilities are barred from many patients. The government's Cancer Health Fund was described as insufficient, and experts call for expanded access and coverage. Risk factors for breast cancer include family history, lifestyle, and hormonal factors. Preventing strategies including pregnancy at a younger age, breastfeeding, and avoiding smoking. Experts stress the importance of screening and public awareness to reduce mortality rates, while efforts to improve cancer care and access to treatment continued across Nigeria. All right, Mr. Martins, here we are. Experts are rather saying that the new minimum wage, 70,000 naira, is making the treatment of breast cancer unaffordable for the people. And I'm wondering why that should be, because a lot of persons were saying that the moment the new minimum wage comes, is being implemented, that at least life will be a little bit easy for Nigerians. So why are they saying that it is making things more expensive and people can no longer go for treatment? How can you balance these two? Make it make sense to me, please.
When I analyzed some of the indications from that report, I observed the clamoring is saying that the minimum wage is still insufficient. That's what they are trying to say, because cancer treatment is expensive. Somebody who, worst case scenario, if you work in Nigeria, worst case scenario, you earn 70,000 naira because it's minimum wage. We are saying somebody who earns 70,000 naira, given prevailing circumstances, may still not be able to afford it because of the size of the funds. Right? That's the point that is being made, and that's why they are talking about preventive measures, so that you rather avoid it, because if it comes, treating it is no. That's what they are trying to say. However, how many states are paying minimum wage already? Do you know any state that's paying minimum wage?
Of course, we know Kogi State have started paying implemented 72,500 naira for civil servants. So
civil servants have received it and come out to say they received.
We shouldn't worry about that. The most important thing is that
facts. When I analyze facts in Nigeria, I don't analyze based on the numbers that government officials are throwing at me.
Okay.
I analyze based on what I'm observing on the streets. Yes, we'll pay minimum wage. 70,000, we'll pay minimum wage. I was a serving copper with 6 months to go when the former minimum wage of 30,000 was approved. I did not benefit from it. Federal government approved it and everything. I did not benefit. The coppers who came after me did not benefit. It was like 6 months, 8 months to a year later that they started benefit. So, yes, statistics aside, statistics are good. It gives us a good indication of what is expected. But what is seen on the street is the actual challenge. Before we start putting pressure on anybody to say the new minimum wage will not be able to afford cancer treatment, let it be implemented. Let people experience it first. Let's do malaria treatment first with the new minimum wage before we go into cancer. I appreciate the fact that they are talking about all the preventive measures. Let's put in the energy to educate people. How many women do you know who know how to do breast examination? NGOs should come out and, like the medical practitioners are coming out to say, put it out there. Teach people how to make this examination. Sometimes when I go on YouTube, I see a lot of adverts that are meaningless. Nonsense adverts, productivity adverts are lacking, and health advice is lacking as adverts. So put up videos on how to do breast examination so that the grandmother in the village knows how to teach their children to do all this examination. And then all this alternative treatment, like they said, the way to verify that you don't have cancer is to go to a specialist and actually check that you don't have cancer. People should get into the habit of checking. Tests are expensive in Nigeria, so people don't test. Everything is malaria and typhoid. Whatever people feel, malaria and typhoid, even when it's not. So people should get into the habit of checking for lumps, going for tests. Pain is your body's way of saying something is wrong. So we shouldn't take pain relief and keep going with life. You observe pain for some time, you go and get so that it does not get to the stage where you need treatment, because 70,000 minimum cannot get you the treatment.
Well, I'm wondering, is it not a way of telling the government that they are not doing anything? Because when it was 30,000 naira, there were people who actually went through this kind of let's call it sickness, and they were able to treat it. Now the money has been increased to 70,000 naira, and they are saying that it is not enough. How much is it going to be increased before they will know that indeed it can actually take care of this thing? Because when we were talking about
700,000 naira, you come up with things that 700,000 naira cannot buy.
Exactly.
Human is an insatiable.
Exactly. So why can't we appreciate the little we have and move forward?
I don't know. So my point is, rather than coming out to complain about minimum wage, I don't know how they were able to cleverly tie minimum wage to cancer treatment. People who are any minimum wage. Nigeria is a very religious country. Pray you don't have a need to treat cancer. And then beyond any minimum wage and treating cancer, stuff like health insurance should be preached in this country. Preventive measures and health insurances. We shouldn't wait until there is a need for treatment before we get certain insurances. Pay for health insurance so that even tests, I think some insurance package covers for tests. The money you pay for health insurance might not be able to fund the tests, but the insurance can fund the test so that you can get regular checkups, you can monitor your body. How many people know the ideal color of urine? So that when their urine color changes, they'll be able to know that something is probably wrong somewhere. You get? So these are some of the health tips that Nigerians should know. NGOs practicing in Nigeria, medical practitioners, at your little level or at your great level, come up with things to enlighten people on their health so that we will not need to pay for cancer treatment. It's expensive.
All right. Thank you so much, Mr. Martin. I think I must get used to this name, Honorable Martins. Thank you so much for joining me on today's show.
You don't have to.
Thank you.